But just 5 days ago, was it 5 days ago? Less than a week ago, it was our first time meeting, and now it seems so much has happened in the last week. During the last week, let's see, what have we done? On Monday,
the district health officer and changed district. It's the only person I met on Monday.
On Monday, and but it was a very eventful meeting. He was very excited. And Tuesday, we started off our day with the Minister of...
the Deputy Director for the Ministry of Health. Also, after explaining what the health system is doing in Malawi and something similar to what we're trying to bring in, she was actually also wanting to know more about this.
And we left there and we drove to Salima.
Yeah, where we just visited one of the health clinic that was built by Raising Malawi.
That was my first clinic that I saw, and I was very impressed how hard the staff is working, because Malawi has a shortage of healthcare professionals,
right.
And the ones who are here are working exceptionally hard to give healthcare. And so that was Tuesday.
It was Tuesday.
Wednesday, we got up early.
Machinji.
And in Machinji, we had an opportunity to take a tour of the hospital and to get an understanding of how the district works and all the services that are provided by the district.
Yeah.
And we left there and went to
the clinic in Matindi. I can't remember the name. You probably know the name. Mikunda, yeah.
Mikunda. Was it like an hour and a half ride?
Yeah, about an hour, yeah.
In a very rural area, very remote area. And there we had a historic meeting. That was the first time the
traditional birth attendants had a meeting with the district health officers, staff. We also had a meeting with the nurses and all people that are involved at the hospital at Mikundi, and we also had in attendance we had pregnant mothers, and we had lactating mothers, and we had the traditional birth attendants, and we also had the chief.
Ah, that's right. And we also had the mothers. They were pregnant, but they were also waiting. Some of them were waiting to give birth, right?
Yeah.
And do you think that they thought it was a good meeting?
I think there was one brilliant lady who had a baby, who had a 1-year-old baby. I think about not 1, but I think 6 or 9 months. She was very smart because she could bring in some insights to other women on how useful the health system is. But then she also brought up some issues that are related to why women go to the birth attendants, which was very smart. So I thought, they were so enthusiastic about the whole meeting, and I thought they really wanted to see it coming and going.
And how do you think the traditional birth attendants felt about the meeting?
Initially, they thought maybe something that was coming against them. Because they were like, what's going on? And later on, they realized, it's something that is supporting. It's not really trying to brush us off, but trying to understand that we are also important and we can work together with the health system. So that's why I think one of the traditional birth attendants started mentioning that we have been attending meetings with the health people, that we need to collaborate, and we are very cooperative. They showed that they are very cooperative and would want to work with the health people. And all they needed was to be, the ideas, the best ideas that are workable for them to link up with the government. Otherwise, they will so happy.
I found that the medical officer seemed very open to also working with them as well. And we had the pleasure of meeting by phone with the new Vice President, Mrs. Joyce Mata, and she expressed her strong support for anything that we could do to help the women and children in Malawi. That's a special interest to her. And so we'll be following up with her. And this morning, we met with her sister, Miss Angie, and she also expressed a very strong interest in supporting any work that we did here with women and children. We also spoke with Dr. Keith Joseph, the medical director for Partners in Health in NAMO, and established a beginning relationship with him around providing a coordinated effort around looking at the problems and looking at the solutions. So everyone's very excited. Very excited.
Yeah, yeah. Actually, I didn't think that we could meet all these people. You know, we have achieved so much that I didn't expect. So it was really great. It was wonderful that you came. And I've learned a lot from all this because it's also something new, but something right from my heart too, that, you know, women need to be cared for right from the beginning before the child is born. They have to be born in a comfortable, nice, loving environment, you know, where people are also loving. So I thought I learned a lot, yeah, and I'm looking forward to the project happening in Malawi.
I learned a lot too. It's nice to have a place for the women to go and wait before their baby is born or the labor begins. But in that place, they need to have a bed and they need to have food as well. And so those are little things that really make the difference in terms of whether or not a woman is going to make the journey away from her home. And the other thing that I really am aware of is that when countries strive to meet those international standards that every woman should have a skilled attendant at birth, that the time between when we make the decision to do that and the time when we have everything in order to do that, we still have to make provisions for what is going to happen to that woman in the meantime. That's probably one of the most important lessons I'll take away from here. Passion for mothers and children. Passion for mothers and children.
Yeah.
And they were referred to us by the deputy director that we met with on Monday.
Right.
So that was a good thing.
Yeah.
And then we visited an orphanage. And now it's Crisis Nursery. And now it's time to wrap it up. But we are not leaving empty-handed because regardless of what happens, you are now our official birthing project coordinator for Malawi. So we want to thank you for that.
Thank you.
And what are your thoughts about this week?
I have never seen a fruitful meeting like this before, you know, where we have, what I like about it is we went to the community and we interacted with the people that are involved in what is supposed to happen. So to me that was a really brilliant idea. And we started very well because we started by seeing the people that are responsible to link up with those in the rural areas. And the opportunity that we had to meet with the ministry themselves, the main headquarters, was also good. I think anything that deals with women and children would be one of the best that you can do for the women and children in Malawi. And I think at the end of it, the government will appreciate the initiative that is coming up.